Hey friends, Dr. Mary Starr, the Total Wellness Doc, and I am here live, and hopefully, let me check, I'm on the right page and everything like that. Let me check real quick, because sometimes I am known for making lots of mistakes. Let's see. Yes. Okay, we're here live. Awesome. Dr. Mary Starr, the Total Wellness Doc and mom, and here we're going to talk about today the simple technique that could change everything for you and your family. Now, many of you know, or maybe you don't know, I am a trained chiropractor. I practiced for many years, but really practiced things that not a lot of chiropractors did. So I had a lot of specialties in my practice, and I usually got the clients who had seen multiple doctors, who had been suffering for many years and just felt like there was no answers. And then they would get referred to my office and we would find some solutions. And I would say probably 75% of the clients who stuck with me had some significant results. I am known for putting pieces of a puzzle together. So every week on Wednesday Wellness, I'm going to give you a piece of the puzzle. So this week, I'm talking about a very simple technique that could change everything for you and your family, particularly if you are a family or a person who struggles with headaches, migraines, dizziness, even things like tinnitus or like cloudy head, like fogginess, you can't focus, eye strain, head, neck, and shoulder tightness, nausea, unexplained nausea, fibromyalgia, kids or adults who struggle with autism or on the Asperger's spectrum or ADHD, all of that. So what is this technique? What am I talking about? I am talking about, can you see it backwards there? Craniosacral therapy. Now, many people have a misconception when it comes to craniosacral therapy. They think that it is some new age, they think it's Reiki, they think it's this, they think it's that. Whatever your opinion about any of those things, it's not. It's a very scientific, anatomical technique. It was developed by Dr. Upledger, and he was I believe a doctor of osteopathy. I thought he was a physical therapist, but a lot of physical therapists learn this and teach this. A lot of massage therapists, not a lot of chiropractors, because we have techniques that are very similar. But craniosacral therapy is a technique I'm going to talk about today, developed by Dr. Upledger. Very, very scientific, great technique. Now I have Dr. Megan on. Hi, Dr. Megan, how are you? And Dr. Megan specializes working with kids who have a variety of developmental challenges. Maybe it's writing, maybe it is attention deficit, maybe it is very messy eaters or having trouble eating. And she's just an incredible doctor. I want to say in the Midwest, but she can let us know in the comments. But anyway, hopefully maybe someday we can talk about what her specialty and what she talks about. But let's talk about craniosacral. Today I have our special guest, Billy Bones, is with us today. And craniosacral, just to kind of define it in my terms, and if you're a craniosacral therapist, forgive me, but I'm just going to teach it the way I learned it in just very simple terms. It's very light pressure. Hi, Nancy, another massage therapist joining us as well. It's very light pressure. In fact, the pressure is almost like putting like if I were to put a nickel on your skull, that is what the pressure is like. But this is one of the most effective therapies for so many conditions and things going on. Now, of course, they can't say that, and depending on what state your chiropractor or massage therapist can't say that this will help with autism or this will help with your migraines, but it does work. So these very, very light pressures. So a lot of it is based around the skull, and you probably didn't know this, but look, can you see these are called sutures. And when you were born, your skull is actually in a variety, it's not solid, right? You've heard of the soft spot when you're born, and that's to help you get through the birth canal. And babies and little kids can have that soft spot for a long time. But these sutures, here they are, here they are, Here they are. I think there's some in here too. These sutures, or these different areas of bone, are still growing together, and this area will actually move until very late in life. Now, I've felt a lot of heads in my career, and I would say to someone, wow, your head's really hard. And through time, through craniosacral and some other techniques that I would do, their head and their sutures and their body would just start to be more soft. And they would say, you know, I'm not having those headaches anymore. I'm not having that. Because what can happen is muscles can be tight. You could have an injury. You could lay on one side, right? Especially babies. You see babies who lay on one side all the time. They'll get like a flatness on that side. But it even can happen for us too, is that you can have almost like adhesions or stuck. That's how I use it in terms of chiropractic care, is that you can kind of be stuck in some of these sutures or some of these also muscles. There's muscles on these different things. So say, for example, someone had a lot of TMJ. We're not going to talk about that too much today, but they were using, or a tooth issue, and they're using this side to chew so much, and they built up all these muscles, and it got really tight, and it went up into the temples, and that was just really tight. What can happen is these bones that are supposed to move fluidly, right? They still move, not when you breathe, but actually in something called the craniosacral rhythm. I'll explain in a second. They kind of get stuck. So say this side's stuck, and this side has to kind of work harder. And when you're really stressed out and the shoulders and everything get super tight, what can happen is that you can start to feel a little headache or still like a pulsing. Some people can get migraines, different things like that. And I see I have other great doctor on, Dr. Atkinson, on with me too. So craniosacral therapy not only focuses on the skull, but if we were looking at a person here, I know this might be kind of gross, but we're looking inside, we have the brain, right? So we have the brain, we have the medulla part of the brain, and then it goes down into the spinal cord, right? The spinal cord. And all around the spinal cord, all around the brain, is something called dura mater. And dura mater means hard matter or something like that. Dura means hard. But it's kind of like maybe a second skin, you could think, that surrounds it. And that dura mater can get stuck, right? Especially if you have a suture that's stuck, and sometimes it attaches up into parts of the skull. We do know that dura mater, way back here, in this, feel the back of your head right now. Right, the back of your head, feel the back of your head where those two little bumps, where your neck meets your head. Feel those two little bumps? I bet you on a lot of you, you'll feel tightness, or it'll even be tighter or bigger on one side than the other, right? Especially if you're looking at a computer all day, or, you know, different things can cause that. That overgrowth of muscle, that's called the suboccipitals. It's a little triangle of muscles there, and they can get tight. They can get trigger points, but they're also attached. Research have found that it's attached to the dura mater. So if you have a tight back, suboccipitals, those tight balls on the back of your head, you could literally be pulling at the dura mater. That's right. Now, what would we expect like that? If dura mater covers, and it's as your body breathes, you also have a rhythm. Because you have the dura mater, then you have spinal fluid, then you have the brain and the spine, right? So if that dura mater's stuck or being pulled down, do you think the spinal fluid can flow nice and easy? Probably not. For those, oops, I lost my mouth. But anyway, for those of you who do a technique, how many of out there do a technique called raindrop technique? This is something I've taught and done thousands in the 20 years I've worked with Young Living. But that technique, we hold the feet, right? And in craniosacral therapy, we hold the feet. And we feel for this rhythm literally the body going back and forth. So we feel this rhythm of the craniosacral fluid. So kind of the body going up and back, up and back, up and back. Okay, so what do I mean about all this? Well, in that technique, raindrop technique, we can actually feel if the body's off, right? We can kind of feel if things aren't balanced. And the same thing with craniosacral therapy. So different techniques, I believe, in my opinion, pull in pieces of craniosacral therapy. But that's not all. Think of this. So your spine, so a lot of it is worked on the head, but you also, that suboccipital area, right? So imagine, okay, so those tight muscles back here, he's got to go, there we go. And this is the top vertebra right here, right, the atlas. So if that's really super tight, in craniosacral therapy, we do a craniosacral hold, where we literally pull and put pressure on those tight back, kind of backy balls of your neck. So that pressure is just a little bit more. And so we wait till that kind of loosens up. So all the craniosacral therapy does is these small pressures. The one on the back of your neck feels a little bit more. And then they also go with the sacrum. Don't think I can lift them up. But let's see. Down here in the sacrum, this area in here, they'll pull down on the sacrum and wait for that craniosacral to release. And what we do is we wait for something called a release, and the body can signal a release by different breath, kind of a pulsing sensation, different things like that. Now, have I confused you? Maybe you feel confused. Craniosacral session can take anywhere from 20 to 50 minutes to an hour. You need to talk to a professional craniosacral therapist. Many massage therapists or physical therapists do this. And some of us chiropractors and massage therapists just kind of have it as an add-on in our practice and in the things that we do. So this beautiful session, though, some therapists too will just use it as needed. Right? So I had a period of time where I had a lot of tension and tightness. And interestingly enough, I would have that every time I got my hair colored too. When I would get my hair colored, I would get a headache, right? Probably from the chemicals or whatever. Not doing that anymore. But I would go see my massage therapist. She said, wow, your head is really tight. And she would do a lot of craniosacral releases. Now with those releases, this kind of goes into even different young living or chiropractic techniques I won't talk about. But sometimes, occasionally, the body will even release like emotional, like they might feel a wave of kind of joy or laughter or even sadness. And this can be through any type of hands-on modality. This just happens. We can talk about that another time, but that's kind of the releasing that happens. Now, I have had people when they get their first craniosacral therapy done with me or other therapists, they'll say, oh, I cannot believe how little the pressure was, but how sore I am the next day. Now, why is that? When you start to relax the dura mater and the cranial rhythm and get fluid flowing, all that tension and inflammation now can get released, right? The muscles can relax, the joints can relax, adhesions were broken up, all those things. So a lot of times people can feel very tired. They can feel like almost sometimes like they're getting the flu. And I've even had people, I'm never doing that again, right? I can't believe how sore I was, particularly people like fibromyalgia, and I think people who have a lot of inflammatory conditions. But don't be alarmed because this is such a phenomenal technique. So the last thing I'll say on craniosacral therapy, amazing for babies and kids. Very, very good for kids who, in fact, Dr. Van Loon, if she's still in practice in Ithaca, is kind of the expert of mommy, baby, craniosacral, cranial release for breastfeeding. Very, very phenomenal for that. And now even many dentists are using this to help kids' jaws grow correctly, for kids to have who are having braces or going to have some kind of work like that, to have that. And in fact, if you are a child or have a child who is having braces, really important to have craniosacral therapy, because think about it, you're literally pulling, right, all the time. So getting some of that craniosacral therapy is really important. In fact, there's some correlations with braces and scoliosis. You can check that out, learn that in chiropractic care. And why would that be, right? If my dura mater and my rhythm can't move and I've got to compensate, right? I mean, my muscles, my joints, and my bones literally can shift with that as well. Now, I've talked too much, but in a nutshell, I believe that craniosacral is one of the most phenomenal things for people who haven't got any relief with their migraines, headaches, even things like dizziness. Older individuals, especially men, with something called Paget's disease, where the bone is actually getting thicker in the skull. Autism and ADHD, I didn't even talk about that. But if you are a therapist who incorporates craniosacral, I didn't know this. When I had autistic kids on my table, I could get them to sit there, lay there for 30, sometimes 45 minutes. And I didn't realize that this was unusual, because when I went to craniosacral training, they said, what? No, I'm lucky if I get my autistic kids on the table for 10 minutes or 15 minutes. But what did I do different in my practice? The thing that I did different in my practice is I was always diffusing in my practice a special essential oil. I'm not going to even tell you. You have to message me to find out the answer. But it was a special essential oil blend. Maybe you can guess in the comments. It was a special essential oil blend that I would diffuse, and I know that was my secret weapon to get those kids, and adults too. People just felt so relaxed in my practice, and that was one of my secret weapons. I diffused that every day, all day, especially in my treatment rooms. So I hope this has been helpful. It's just a little taste of what craniosacral is. Really you have three choices right now. Your first choice is, thanks, Mary, this is some great information. Your second choice is, this is interesting. I want to do a little bit more research, and I really encourage you to go and do your research. But the best way to research is actually to go and get a therapy yourself. Find somebody reputable who does craniosacral therapy. You might have to drive an hour or so to get it done, but check it out. And the third thing you might think about is like, maybe this is something that really could make some changes. And one session is not going to be enough. You really want to find a therapist, get comfortable, and actually give it a go. Maybe a month, maybe a year, once a month, every couple of weeks. And for some of you really struggling, maybe once a week. I don't know. All I know is that this therapy has brought really great relief to so many in my practice, along with the essential oils that I used as well. All right. Berta says brain power, but Pam Jones is a winner. Peace and Calming was the oil that I diffused every day, all day in my practice. Have a great day. I hope this was helpful to you. If you like it, make sure you share it, and go to my YouTube page where you can find more little wellness tips on how you can feel better, you can live better, and hopefully help others as well. Talk to you later. Bye-bye.